Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and vprc.ca. This is clinical tip and trick. So this is meant more for massage therapists. If you're a chiropractor or physical therapist that deals a lot with the soft tissues, muscles, and fascia. Also, if you've got training in it, if you know how to assess and treat the fascia, this is something that you might want to use. Particularly if you're working with spines, like the thoracic spine and lumbar spine, that don't seem to be moving well. So when you're assessing, you notice that it doesn't glide well forward. It's very rigid underneath your hands. And the patient client is basically finding a lot of discomfort, a lot of pain because of the lack of motion around the spine. Maybe muscles are spasmed in the area. So this is what this technique is to help get you to mobilize the spine better, and it's actually through working with the fascia. So after you've assessed and noticed, you might have dug in with your elbow, trying to get the muscles to relax so that you can move the spine, but there's still not much give. The next phase that you want to try doing is basically assessing the fascia of the rib cage, so like right around. And what you'll notice with a lot of these people, a lot of these clients, patients that have very rigid spines that don't really move too well, is that the fascia is very tight around the rib cage. In fact, it kind of looks like just from palpating, just from observation, that the fascia is actually kind of like pulled towards the front. So you'll notice here in this video, like the spine and the rib cage there, and the direction of pull, you'll notice like the fascia is going towards the outside and wrapping around. And when you palpate that area, the tissues don't move too well. So what you will do when you notice is that you're actually going to work on the fascia first, right? So you're going to actually be aggressive around the rib cage, loosen it up around the sides there. And what you'll notice over time is that as the fascia loosens up, the spine should become less rigid. You'll be able to do like your glides or whatever it is you're trying to do to mobilize the spine. You may also find that L5S1 becomes, there's a bit more spacing when you push on the sacrum. It's not as compressed, it's not as tight, when you do this technique. So every once in a while, when you're working on the fascia around the rib cage, assess to see how the spine's moving. And like I said before, what you should notice is that if it is the case where the fascia is super, super tight around the rib cage and it seems like it's wrapping around towards the front, this technique might actually be helpful. So once it loosens up, you can do whatever you need to do, whether it's muscle stripping up and down the erectors, whether it's your mobilization techniques. Give it a try, because it might be helpful in regards to those that have very, very rigid spines, and you might find that you're able to do other techniques to help that patient client out. There you go. There's your tip for the day. My name is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. We'll see you in the next one. Take care.